Was that fun? I couldn't do that a while ago. You see, I kept getting these real bad ear infections, and I always felt stuffed up and dizzy. It seemed like every time I'd go swimming, I'd get another infection. Well, my mom took me to the pediatrician, and they gave me some medicine to stop the infection, but I never really got better. So she eventually recommended me to a specialist called a pediatric otolaryngologist. Whew, that's a mouthful. Anyways, these guys really know ears, and it turns out all I needed was a simple surgery to clear things up for good. Alright, I admit it. When I first heard the word surgery, I was a little scared. But you know, it was really no big deal. Oh, you're seeing those docs. You need surgery too? That's cool. Don't worry. These guys are good. But you know, it might help if you do what I did. Find out as much as you can about the surgery. Then it won't seem so scary. Tell you what, let me get out of this bathing suit and crank up my computer. I know this good website where we can find out anything you need to know about the human body. Sounds cool? Good. Catch you in a minute. Okay, I got the computer fired up. Let's get cranking. First, let's do a little search on ears.
Welcome to BodyLink, your online human anatomy information center. I'm Cindy, your interactive guide. Please type in your name and state your question.
Okay, my name is Eddie, and my question is, who makes the world's best pizza?
Sorry, Eddie. That information's not in my database. And besides, it's a silly question. Would you like to know something about ears instead?
Oh yeah, I was just joking with you.
As you probably know, ears are a very important sensory organ. Hear that? Well, you wouldn't if you didn't have ears. Ears allow you to hear a wide range of sounds. And did you know they also help you keep your balance? Your balance is controlled deep inside your inner ear. Ears are also connected to your nose.
Ears connected to the nose? Well, I've had a runny nose, but not a runny ear.
Runny ear? Cute, Eddie. You probably had a runny ear, nose the last time you had a cold. Do you remember how you felt?
Yucky. I was stuffed up and dizzy, and my ears were ringing.
It's kind of funny, when you're stuffed up like that, sometimes even your food doesn't taste right. That's because your sense of smell is off. But that's not all. If you're not hearing correctly, especially for a long time, your speech can be affected too.
Wow, I didn't know that.
Now do you see why ears are so important?
Yeah.
Any more questions?
I know what ears look like on the outside, but what do they look like on the inside?
The ear is made up of three main elements: the external ear and ear canal, the middle ear, and the inner ear. The process of hearing begins with the outer ear picking up and collecting sounds. If you use your imagination, you can picture the ear as a funnel on its side, bigger and roundish on the outside, narrowing down to its smallest point on the inside. The outside of your ear funnels sound down through the ear canal to the tympanic membrane and then onto the inner ear.
Tympanic. That sounds like the name for a kettle drum, a timpani.
That's a very astute observation, Eddie, because the tympanic membrane is also called the eardrum. So after these sounds leave the eardrum, they head to the middle ear. This part of the ear is a little like those big amplifiers used by rock bands. Amps make music louder, and the middle ear makes sounds louder too.
Cool.
Finally, the inner ear transforms those amplified sounds into nerve impulses. Those impulses are sent to your brain where they're instantly interpreted and categorized. Now, inside your middle ear, there are three small bones: the malleus, the incus, and the stapes. These are commonly known as the hammer, the anvil, and the stirrup. Say, Eddie, want to impress your science teacher?
I'd do anything if get me an A in biology.
Can you name the smallest bone in the body?
Not off the top of my head.
Well, it's not on the top of your head. It's in your ear. It's that little stirrup thing, the stapes.
Hey, I'll remember that. The stirrup.
Any more questions, Eddie?
No, I don't think so. Thanks, Cindy. I was just going to tell my friends a little bit about my ear surgery.
Why not talk to the experts, Eddie? I'll give you a direct online link to your pediatric ear, nose, and throat doctors. They'll tell you everything you need to know about common middle ear problems and how they're fixed.
That'll be cool. They might be the same doctors I'm seeing.
Please stand by while I make your connection.
These guys are ear specialists. They really know what they're doing.
Okay, Eddie, you're ready to go. Just type in the doctor's name and you'll be connected to a live link at their location. See you later.
Thanks.
Hey Eddie, what's up?
Not much, Doc. My friend and I would like to know something about common middle ear problems. But first, I'd like to know why you're called an otolaryngologist.
An otolaryngologist is a specialist who's primarily concerned with the medical and surgical treatment of the ears, nose, and throat problems.
Oh, so you're a head and neck man, eh?
Oh, I guess you could say that. Now let's talk a little about the middle ear. In our practice, we see lots of kids who have problems with their ears. One real common problem is perforations or holes in the tympanic membrane.
Oh, we just talked about the tympanic membrane a few minutes ago. That's the eardrum, right?
Correctamundo, Eddie. An eardrum can be perforated by infection or injury. It's usually just a small hole, but it can cause a lot of problems if it's not fixed.
What kind of problem?
Well, a hole in the eardrum could certainly affect your hearing, and depending on the size of the hole, it may cause pressure problems in the middle ear, which could affect your balance. It could also open the door for infection.
All that from one little hole?
You bet. That's why getting it fixed is so important. If it's not repaired, sooner or later that little hole is going to cause a big ear problem. The good news is, in most cases, it's a pretty easy fix. One way we repair the ears with a fairly simple procedure called laryngoplasty. It's kind of like using a patch on a bicycle tire. We make a little graft using special tape or some fatty tissue in your earlobe and patch the opening in the eardrum. After a little while, the skin heals and the hole's closed.
That sounds simple.
It is. Surgery is usually performed when the hole in the eardrum is small and it's an isolated problem. That's kind of unusual. If there's chronic infection or more involved problems with the ear, we use another type of surgery called tympanoplasty. This surgery is a little more common, but it's a much more complex repair. With tympanoplasty, we use tissue from the temporalis muscle behind your ear to patch a hole in the eardrum. And because this is such a tiny area to work in, we have to use special equipment to see what we're doing. Basically, we use a big microscope with itsy-bitsy little instruments. With babies and very young children, their ear canals are so small we can't get in through the ear, so we have to make a little cut behind the ear to get to the eardrum. In older kids, we can perform the same surgery right through the ear canal.
When I had surgery, I didn't feel a thing.
That's right, because we use something called a general anesthetic. We give you a little mask and you breathe some special sleepy air that puts you into a deep sleep. Our patients fall asleep with a hole in their ear and they wake up with it fixed. It's that simple. Now when they wake up, some smaller kids might be a bit confused or scared because they're in a strange place. But they're usually okay as soon as they see their mom and dad. And sometimes the ear is a little sore afterward, but it's really surprising how little pain there is. So Eddie, any more questions?
Well, I'd like to learn more about some other middle ear problems.
Okay, that's easy enough. Just type in Dr. Andrews' name and he'll fill you in on something we call cholesteatoma.
Cholestea what?
Cholesteatoma.
Easy for you to say. Okay, so I'll give Dr. Andrews a try. Thanks for your help.
Thanks, Eddie. Good luck.
That was interesting, wasn't it? I wonder what this whole cholesteatoma thing is.
Well, that about wraps it up. Hey, I'm getting a message on my computer. Hey, Eddie, I heard you'd be getting a call from you.
That's right, Doc. I was just talking to Dr. O about how eardrums are fixed. He told me you could tell me a little more about something called a cholesteatoma.
Sure. A cholesteatoma is a pretty common problem with the middle ear. It's probably best described as extra skin growing where it shouldn't. Sometimes it looks like a cyst or lots of pasty white stuff that can lead to a lot of problems. It can cause massive infections, or it may erode the bones in and around the middle ear, or even into the brain. A cholesteatoma can damage your hearing and affect your balance. It's destructive, so we try to take it out as soon as possible.
Sounds serious.
It can be if it's not removed.
Well, how do you get this extra skin stuff out?
Dr. Orbello told you about the tympanoplasty, right?
Yeah.
We use the same approach to get through the eardrum to remove the cholesteatoma. A lot of times we'll find something called mastoiditis.
Paging Dr. Andrews. Dr.
Sorry, that's for me, Eddie. Sounds like our break's over. If I don't get back to surgery soon, they're going to send out a search party.
While Dr. Andrews answers his call, let's look up with Cindy over at BodyLink to see if she knows anything about this mastoiditis.
Eddie, you're back. More questions?
Yeah, we were talking to Doc Andrews about cholesteatomas, and he mentioned something called mastoiditis. Can you tell me what that is?
Sure. Let's look up middle ear problems on the BodyLink database. I know you'll find mastoiditis mentioned there.
Oh yeah, he was telling us about cholesteatomas, that extra skin stuff.
Well, Eddie, it says here those cholesteatomas are the reason why we have problems with mastoids. What happens is this extra skin starts growing into the mastoid. This infection gets into the bone and becomes resilient. That means it's tough and it won't go away. In fact, one of the ways doctors know there's a problem is patients keep getting ear infections that can't be cured with antibiotics. That's what they call a symptom. And that's a clue that shows them where to look for problems.
So I guess you could call doctors body detectives, because they're always looking for clues to figure out why we're sick.
An excellent deduction, Watson. You know, when you think about it, doctors really do spend a lot of time looking for clues to help you feel better. Speaking of doctors, I just got a message from Dr. Andrews. He's back in his office if you want to talk.
Sure.
I'll connect you.
Thanks.
Hey, Eddie. I caught the last part of what Cindy was saying, and it's true. We're kind of like detectives. That's why we ask you a lot of questions about how you feel. We'll take your temperature and look in your ears, nose, and throat. If we see something that's not normal, like an inflamed eardrum or drainage from the ear, we know from our experience and training that it's probably some type of ear infection. We also know if the antibiotics don't solve the problem, then there's probably another reason for the infection. An infected mastoid could be the cause. That's called mastoiditis. When we find mastoiditis, we often perform a procedure called a tympanomastoidectomy to get rid of the problem.
Wow, that's a big name. Dr. Orabello talked about tympanoplasty. Is that similar?
You remembered that? Boy, Eddie, you're on the ball. Well, a tympanoplasty is part of the process. To get rid of the problem, we lift up the eardrum, and just like the tympanoplasty, we use a microscope to see what we're doing. Once we're in there, we find the source of the infection. If it's in the mastoid bone, we clean it all out, including any cholesteatoma and damaged bone. That way, the ear can heal completely. We call this operation a tympanomastoidectomy.
Doesn't anything medical have a short name?
Well, Eddie, if we didn't use big words, how would we know if it was important? Speaking of big words, I have to read up on a new procedure. Have you talked to Dr. Cressman yet?
No, not yet, but we'll give him a buzz in a minute. Thanks a bunch, Dr. Andrews. We'll see you later. Wow, we're really learning a lot. I guess I'd have to take up Latin if I want to become a doctor, but I don't know about that. I'm having a hard enough time with English. But let's type in Dr. Cressman's name and see what he has to say.
When would you like to see this patient again?
How about next week?
Look, there's someone on your screen.
Hey, Eddie, what can I do for you?
Well, I've been talking to your partners about common middle ear problems, and we've covered eardrum repairs, cholesteatomas, and mastoiditis. But is there anything else we should know about middle ear problems?
You've talked about most of the major problems. One thing you didn't mention was conductive hearing loss. That's a loss of hearing because of the problems with the bones in the ears.
Well, how does that happen?
Oh, different ways. Sometimes people are born with their ear bones fused together. That's called a congenital birth defect. If the bones don't move right, it will keep you from hearing well.
Are you talking about those little tiny bones in the ear? The hammer, anvil, and stirrup?
That's right. Conductive hearing loss could also be caused by bone erosion. That happens when infections hang around too long and there's fluid in the ears. Cholesteatomas could also be the source of the problem. Unfortunately, we can't really know for sure why there's a conductive hearing loss unless we do an exploratory surgery.
What's that?
That's an operation that allows us to get a good look deep inside the middle ear. Once we determine the problem, we can get right to fixing it.
Do you use a microscope?
How did you know?
The other doctors mentioned it.
Sounds like you're learning something. That's good. You know, there's not a lot of room in the middle ear, so we have to use some special tools for our surgery, like a surgical microscope. And sometimes we find ourselves combining 2 or more procedures because we find more than one problem while we're looking around inside the ear.
Is conductive hearing loss something you can fix?
We can remove the infection if that's the problem, and almost all of the time we can improve hearing. Unfortunately, it's possible though that the damage is so bad there still might be some hearing loss. And sometimes we remove the bones and replace them with man-made parts called prosthesis.
Well, Doc, I'm sure you need to get back to your patients, so I don't want to keep you any longer. Thanks for your help. I really feel like I'm learning a lot.
Anytime, Eddie, and remember, take care of those ears.
Sure thing, Doc. So long. Oh, I just thought of something. We didn't talk about preparing for the operation. Let's get back online with Cindy at Bodylink and see what she has to say.
Hello, Eddie. More questions?
Just a few. We talked to the docs about common middle ear problems. Now I need to know a little bit about preparing for the surgery.
First, there's a few things you should know. One of the best ways to prepare for surgery is to get in the right frame of mind. A good attitude starts with understanding all the facts regarding the surgery and eliminating any unnecessary fears. Parents can do this by discussing the operation with the child. If the child understands the procedure, this often helps avoid any problems. Before surgery, you'll get a package of consent forms and information sheets regarding the procedure. It's important parents and guardians review this information carefully and follow instructions on the forms. If they need any help or have questions, ask your doctor or someone on their staff. They're always available to help. Here's a few things that must be completed prior to surgery. We call this a pre-op checklist. First, if you have to cancel your procedure, contact the surgery scheduler immediately. Also, contact the scheduler right away if there are any changes to your phone numbers or insurance policies prior to surgery. If the patient's been given a prescription for lab work, make sure it's completed 3 to 5 days before surgery. The patient can't have had any recent vaccinations prior to surgery. If the patient develops RSV, pneumonia, bronchitis, or is exposed to chickenpox, contact your doctor's office immediately. A pre-admission nurse from the surgical facility or hospital will contact the patient's parents or guardians the day before the operation. This nurse will tell you when the patient must stop eating and drinking prior to surgery. Also, the patient can't have any aspirin or ibuprofen for 2 weeks before the procedure. This information is very important, so be sure you follow the nurse's directions carefully. Finally, be sure to bring the history and physical form with you the day of the surgery.
Wow, that's a lot of info.
It sure is, Eddie, but it's very important to understand and follow all these directions carefully. Remember, if you have any questions, please call the staff at your doctor's office. They're always happy to help.
Is there anything else we need to know?
Just a few more things. As a precaution, contact the doctor's office immediately if after the surgery the patient experiences nausea or vomiting for 12 to 24 hours after the procedure. You should also call if there's a persistent fever. The chance of these things happening are remote, but you can't be too careful when it comes to surgery.
Right. You can't be too careful, especially with my ears. Hey, thanks a bunch, Cindy. We can all feel a lot better, especially now that we know what's going on.
See you later.
I think we have all the info. We talked about ear problems and surgeries. I feel good about the docs. They took good care of me, and they'll take good care of you, too. I should be going in for my appointment real soon, so maybe I'll see you at the doc's office. So what are you waiting for? Do what I did and get those ears fixed for good. Me? I'm headed back out to the pool. Catch you later. Oh yeah, and tell the docs I said hi.